Good evening and welcome to Left, Right and Centre. I'm Ankita Mukherjee. The big story right now, Prime Minister Modi has proposed a COVID-19 emergency fund where India, he says, could contribute up to $10 million. He spoke about this in his conversation with members of SAARC nations, SAARC leaders coming together today to evolve a joint strategy to fight the novel coronavirus outbreak that has now killed more than 5,000 people worldwide. Well, here in India, the number of coronavirus cases reached 107 today, with Maharashtra having the highest number of cases, 31. Most of the 14 new cases that have been reported, in fact, are from the state of Maharashtra. Kerala has reported 22 cases of the virus. Uttar Pradesh, 11. All 14 patients in Haryana are foreign nationals. Delhi has reported 7 cases so far. One of them has died. And of course, most schools and colleges in the country have now shut down. Offices are encouraging their employees to work from home. Cinema halls are shut. Festivities and convocations stand cancelled. Even Parliament has barred visitors. But at this point, the focus seems to be really on testing. Even the World Health Organization has recommended aggressive testing for COVID-19. And in fact, the WHO has gone on to say countries should not be punished even if they push for aggressive testing. And it has also said find cases so we can turn the tide. Now, the big question, of course, is why is India at this point not conducting more tests? What are we talking about? Well, India so far has conducted a little upwards of 6,500 tests, whereas, for instance, South Korea has tested 249,000 patients. And in fact, if anything, the South Korea model is being held up as one that seems to be paying off because daily the confirmed cases are going down. So who in India is being tested right now? By case definition, only those who have symptoms and also contact history, which means they've come directly in contact with someone else who is confirmed to be a COVID-19 positive case, whereas South Korea, for instance, is doing over 15,000 tests per day. And in India, the private sector, as you know, is not allowed to test. Only government-approved laboratories are checking. So, given all of this and with all of that in mind, let's take this across to our guests. Joining us on the discussion tonight, Dr. Anil Kumar. He's the head of department and professor of urology at Safdarjung Hospital. Also joining us this evening, K. Sujata Rao, former health secretary. Sujata Rao, let me begin with you. This is a question that a lot of people are asking at this point. Are we testing enough? And would those numbers of positive cases be actually far higher than what we're reporting right now?
I'm not so sure that one can, really finally say a word now on this issue because, you have the Japanese model where they have not really gone into such aggressive testing. And whatever testing they've done is for epidemiological purposes, not necessarily for case finding. Whereas South Korea was very aggressive because their objective was to find cases since in their country the virus had spread into the community. Now, therefore, any strategy that a country adopts has to be based on its own context.
Right.
In India, as the government has been repeatedly saying, we are still in stage 2. Which really means that the virus has not gone into the community, and therefore we are calibrating our strategy to go step by step. Right now we are trying to look at, this is of people who have been abroad have brought in the infection, and we are trying to therefore look at the clusters of such people and test them out. It's easy to say, why don't you just expand testing, let every private laboratory do the tests. It's not that easy. They are expensive, they're complex, and secondly, you just can't go around testing anyone who wants to have a test just because they feel unwell. So I think I would rather agree with the government's approach of going steadily and let us see how it progresses. The last 2 weeks, the virus number of infected cases have really shot up much more speedily than it was the case before. So I have a feeling sooner or later they will take a view on whether they should open up more testing sites
Right.
to do more tests, including some good laboratories in the private sector. But I think you have to give space to countries to draft their own strategy, rather than just do a copycat strategy of one country or the other, because each one has to deal with the epidemic the way it is unfolding in their own context.
Right, but Sujata Rao, the fact that India can actually do 10 to 20,000 tests a day, it has the capacity. So, would you say, despite having the capacity, its strategy to not test anyone who has not had direct contact with a confirmed COVID-19 case is one that is paying off?
See, Ankita, I'm not a doctor, but all I'm saying is there are several types of flu going on in the country.
Right.
And several people have colds and coughs, but not every case is a COVID case. So if you start testing each one who has a cough, cold, and who has some symptoms of a flu, which is a self-limiting illness, I mean, what does it really show? Having said that, yes, I think it's give it a matter of few days. I do think that India will have to take the decision to spread the tests, the testing rate much more, to see whether we have COVID even in the general public and not only from those people who have come from abroad. So it will have an epidemiological value also if they can identify people who who have the probability of having COVID cases and do some testing among them, rather than just open it up and say anyone who feels unwell can be done. I don't think we are in that stage as yet.
All right. Dr. Anil Kumar, is that an assessment that you would agree with? You know, on the one hand, you have the World Health Organization saying aggressive testing is needed and find cases so we can turn the tide. Obviously, we've had instances of cases of COVID-19 patients who have in fact been in contact with many more people who have traveled and not self-quarantined and so on. So at least on the face of it, it would appear that there could be many more cases right now than are being reported or confirmed.
So I want to stress on a few points here. The coronavirus, there is an incubation period, which is around 1 to 14 days. Median is 5 to 6 days. And the symptoms, they start after this incubation period. So one problem is when we test these patients, they are still in the incubation period, the test will come as negative.
Right.
So this will be a wastage of your resources. And the second thing is, there is early phase in which patient has high grade fever, cough, and later phase he develops dyspnea, shortness of breath. So the studies as per WHO report shows if you do too early testing, it will be negative, falsely negative. So I think the government right now is focusing on those patients who have been exposed to suspected cases or they have a history of international travel, and they are those who have developed the symptoms, only those patients they are trying to screen. Because if you do the screening in a normal patient,
no,
then
I'm not even talking about just symptoms, but the fact is that the tests are currently being restricted to those who have symptoms and also have contact history. So my question to you, Dr. Kumar, is how do you know about contact history? You may not know of a specific instance, you may not have traveled abroad, but that doesn't mean that you necessarily haven't had contact.
So yeah, this is one point which I think government is also trying to find out, how to find out this history of exposure. As we know, some reports have come, the patient have not disclosed that they have the history of travel to certain areas.
Right.
So now I think as we will see next few days, if the number of cases are increasing, maybe we have to start community based screening also. Like this is not easy job, 130 million people across the country, you cannot start simultaneously in all the states. But yes, if the condition worsens, government may try to do this in a community setting. But right now, I think the approach is quite justifiable, because what we are doing is we are trying to find out the suspects and do the screening on those patients only.
Right. Sujata Rao, I mean, in terms of the larger precautions that are being taken, schools and colleges being shut down, offices being told to encourage people to work from home, movie theatres being closed down in at least some states, would you say that these are all precautions that must now be replicated across the country?
It's again a judgment call, Ankita. It's very difficult to say what is right and what is wrong. But I can see the logic of these governments which are closing down places where people tend to aggregate. That's largely because of social distancing. And the objective is to contain the virus from spreading and disrupting the transmission route.
Right.
So to that extent, the very fact that India is having rather few cases comparatively to other countries is showing that maybe social distancing is having its own value. But the point here is, have we done it a bit too soon?
Okay.
What do we do if it really, tomorrow we end up with about 300 cases? For how long will you keep schools closed? For how long will social life be disrupted in this manner?
Right.
These issues do and will come up. So here again, the response has to be a bit more calibrated than just saying no weddings, no gatherings, no parties, no nothing. It becomes very difficult because psychologically people then get afraid.
Right.
And it becomes difficult for them to sustain that pressure on themselves,
Right.
Social life cannot be disrupted beyond a point.
Yeah.
So this is again, as I said, a judgment call. It's a quick risk they're taking of saying, by doing this now, can we stop the transmission? It's something like the one-way, alternate number cars for cutting down pollution,
Indeed.
something like
Yeah.
that.
Yeah.
So
Yeah.
the issue is that if the increases much more,
Yeah.
then the response will have to be a bit more severe. But
right, you think that might have been preempted already with these steps? Okay, that's very interesting. Dr. Anil Kumar, I mean, we are seeing a lot of workplaces now adopt these practices, and state governments, of course, coming out with these notifications, especially for educational institutions and so on. Do you feel that perhaps this is a bit premature and we could have waited, as Ms. Rao is saying? But also, what about this sudden spike that we are seeing in cases in Maharashtra today? That really has been the big headline. We've jumped from 15 cases to 31 cases in one day. Isn't that worrying? And then when we talk about social distancing, how is social distancing even possible in a city like Mumbai, where everyone is kind of packed cheek by jowl, everyone is using the suburban railway system, and you have literally lakhs of people, moving in very close proximity?
So firstly, answering your first question, is it preemptive? I don't think so, because as per we are seeing in other countries, the epidemic is rising to a very, very worsening manner. And in India, we have already 93 cases. So our main aim of doing this is to spread this disease to the general population. So basically, we're trying to flatten out the curve of this epidemic, so that if once the epidemic rises to the peak, you have a really crisis of the health resources. You don't have so many resources to deal with so many patients. So what government is doing is trying to decrease the speed of rise of this curve and trying to flatten this curve. So this is a very appropriate step right now. It might look like too very preemptive and too harsh, but I think in a long run it will pay off, and we will see that eventually the number of cases will go down. So your second question was in Mumbai sudden spike. What I feel,
Maharashtra, not just Mumbai alone.
So what I feel that what has happened, like we have few patients, they are coming from international countries, we are scanning them, but they are in the prodromal phase.
Right.
So they might have escaped those screening, and once they go to the community, then they develop symptoms and they start spreading. So this is something which government even cannot control. Here we need the cooperation of the general population. They should have come themselves to the health authorities and could have said that yes, I have developed the symptoms, please test me. This is what is required in the current scenario. Government cannot do everything. It has to be a joint effort
a
from the
civilian-based
population.
effort as well. But I think that brings me to that last question I was asking you. How is social distancing possible in our very crowded metropolises especially?
So you're right. I mean, this is not an easy thing. If you're traveling in a metro, hundreds of passengers, they are jammed in a one cubicle. So here again, our etiquettes, they have to be there. Like we are stressing from the day one. Your sneezing etiquettes, coughing etiquettes, they have to be in the place.
Right.
And if you feel that somebody is not adopting those etiquettes, it's better to use a mask. So
Right.
for your own safety,
Yeah.
use a mask. Here I want to emphasize, just wearing mask will not help. You have to
right.
have a hand sanitizer in your pocket all the time. Like I always keep this in my pocket.
Yeah.
This is an alcohol-based sanitizer. Whenever
Right.
you feel you are at a risk of exposure, you try to use it at the same time along with the mask. This only can decrease the risk of transmission.
All right, we'll leave it at that. We're completely out of time. But thanks very much indeed, Sujata Rao and Dr. Anil Kumar, for joining us on this discussion. It's something that we're going to keep focusing on, the various aspects of this as now nations come together as well. We've seen the SAARC countries get together and talk about a joint effort going forward from here to fight COVID-19. And in fact, EU countries are going to be doing the same thing tomorrow. We'll keep focusing on this massive global story. We'll take a very quick break. Back with lots more.